Good afternoon, everyone. So, my next topic of discussion, which I'm going to discuss with you, is broad spectrum antibiotics, that is tetracycline, that is protein synthesis inhibitors. And I'm going to discuss with you in this lecture about the tetracyclines. And before I start my video, I want to request you, if this video appears useful to you and if it is helpful to you, kindly subscribe to my YouTube channel, that is Dr. Nitika Han's Pharmacology Discussion. So now I'm going to start the video. Now, tetracyclines. What I will discuss in this lecture is introduction and history, the classification. What are the classification of tetracyclines? What is the pharmacokinetics of the tetracyclines? What is the mechanism of action, resistance, antimicrobial spectrum, therapeutic uses, adverse effects, individual drugs, and precautions. These are the headings which I'm going to discuss with you. Introduction and history. In 1940s, soil actinomycetes were systemically screened for the elaboration of antimicrobial substances, and the tetracyclines are obtained from soil actinomycetes. A class of antibiotics named, it has 4 cycles in the structure. This is the 4 cycles in the structure of tetracyclines. Hydrocarbon rings, 4 tetrahydrocarbon rings. These are all obtained from soil actinomycetes. And basically, the first tetracycline was chlorotetracycline, then oxytetracycline, then tetracycline. Now, tetracyclines can be divided into natural and semi-synthetic. Natural are chlorotetracycline, oxytetracycline, tetracycline, and demiclocycline. Semi-synthetic are doxycycline, minocycline, meclocycline, and metacycline. Now, accordingly, they have been divided into 3 groups. That is long-acting, short-acting, and intermediate-acting. Short-acting is they have a short duration of action, 6 to 10 hours. These are less potent, mildly absorbed. And as they are short-acting, so they are given 4 times a day or 3 times a day. And renal excretion is it is excreted through kidneys. And group 2 are intermediate acting. These are having the half-life of 12 to 16 hours, and these are moderately potent, moderately absorbed, and 2 times daily the dose is given, and these are partial renal excreted. Longer duration of actions are highly potent, they're completely absorbed, and once daily dosing is required, and this is excreted in the liver, so these are longer acting. Now, group 1 has the short acting. These are chlorotetracycline, oxytetracycline, and tetracycline. Quote from the mnemonic quote: chlorotetracycline, oxytetracycline, and tetracycline. Group 2 intermediate acting are demiclocycline and metacycline, demi. And group 3 long acting are doxycycline and minocycline. Domino, that is doxycycline and minocycline. These are the tetracyclines coming in the long acting. Now, this is the pharmacokinetics. Again, the same thing. Short acting, intermediate acting, and long acting. Intercellular absorption is mild in group 1, moderate in group 2, and complete in group 3. Plasma protein binding is low in group 1, moderate in group 2, and high in group 3. And these are renal excreted in group 1, and these are partially metabolism, so slow renal, and bile and feces in group 3. And alternation of intestinal flora is high in group 1, it is less in group 2, and least in group 3. And incidence of diarrhea is high in group 1, and it's moderate in group 2, and it is low in group 3. Absorption, incomplete intestinal absorption. Group 1 and group 2, they are having the incomplete intestinal absorption. Empty stomach, so they are given chlorotetracycline, oxytetracycline, demicycline, and tetracycline 60%. Group 3 are complete intestinal absorption is there, 90% doxycycline, and minocycline is 100%. Now, chelating property with dairy product and aluminium, magnesium, calcium, iron, and bivalent tetravalent ions means they have a chelating property with these ions. So, food decreases absorption of these all tetracyclines except doxycycline and minocycline. And these tetracyclines, they get inactivated by the chelation by calcium, magnesium, aluminium ions, and iron ions. Distribution is these are very much distributed to the body tissues, and they accumulate in liver, spleen, bone marrow, and teeth. The cross-blood-brain barrier, CSF, placenta, breast milk. Excretion is basically, these are excreted in the kidney, in the urine, and minocycline is metabolized in the liver. Group 1 and Group 2 are excreted in kidney, and Group 3 by bile and feces, that's enterohepatic circulation. So these are safe in renal failure. That is, doxycycline is safe in renal failure, and minocycline also, because it's excreted in the bile. So it is safe in renal failure. Mechanism of action is they have the drug, they enter, they're bacteriostatic in nature, and they enter the bacteria gram positive by active transport, that is cytoplasmic membrane, and gram negative, they enter by porin channels as passive diffusion in the cell membrane. And they bind to the 30S ribosome, and they inhibit the attachment of amino acid tRNA to the A site. Thus, inhibition of protein synthesis takes place. Acting by binding to 30S ribosome of susceptible organism means the protein synthesis I'm going to discuss in the further slides. They have the 30S and 50S ribosome. At tetracyclines, they bind to 30S ribosome, and they inhibit the attachment of amino acid tRNA to the A site, acceptor site of the mRNA. And thus peptide chain fails to grow and protein synthesis is inhibited, and these are bacteriostatic in nature. Now, this is all the protein synthesis inhibitors. How this action takes place is, this is the peptidyl side, this is the amino acceptor side. Now, peptidyl side has the amino acids attached to it. It's like 1, 2, 3, 4 amino acids are attached. And this newer amino acids comes from the amino acid tRNA from the outside, and it attaches to the A site. It has the codon, A site has the codon on the mRNA, and this anticodon of amino acid tRNA will attach to the A site of the amino acid, and then the peptide bond will be formed between the amino acids of the P side, that is peptidyl side, and the A side, and it will shift from the P side to the A side. And now, if we have to accept the another amino acid, then we have to free this acceptor site. So there will be translocation process, that is translocation of the amino acids from the A side to the P side. Again, that from the A side to the P side, the amino acids will be shifted, and this A side will be remaining free for the another amino acid. This is the process of the protein synthesis, and this tetracyclines act at inhibition of the attachment of amino acid tRNA on the mRNA, and peptide bond is peptidyl transfer is inhibited by peptide bond is not formed by the chloramphenicol, and translocation process is inhibited by that is from the A site to P site. The translocation process is inhibited by macrolides, quintustrine, and clindamycin. And aminoglycosides cause misreading of the mRNA, means the codon will be misread, and the strong protein will be formed, which will be cidal in nature. So aminoglycosides are basically cidal in nature, and they act by killing the bacteria. This is how inhibition of protein synthesis by antibiotics takes place. Chloramphenicol, it binds to the 50S RNA and inhibits the formation of peptide bond. I have already told you. Erythromycin, which is a macrolide, it will prevent movement along the mRNA, that is from the A site to the P site. The movement will not be there. Tetracycline interferes with the tRNA anticodon reading of the mRNA, means it will amino cell tRNA will not attach on the codon. mRNA codon, and it will be not attached, so protein synthesis will be inhibited. And streptomycin, it changes the 30S tRNA, causes the mRNA to be read incorrectly. Aminoglycoside pictures. Why they are not affecting to the host cells? Because tetracyclines do not bind to the 40 and 60S ribosome subunit. The prokaryotic ribosomes are 70S, means large subunit is 50S and small subunit is 30S, and eukaryotic ribosomes are 80S and 40S. And these tetracyclines do not bind to 40 and 60S, but they bind to the 50S ribosome. Difference in structure between prokaryotic and eukaryotic ribosomes, making antibiotics selectively toxic against bacteria. Carrier involved in active transport of tetracyclines is absent in host mammalian cells. The carrier which is involved in active transport of tetracyclines is absent in host mammalian cells, and they're basically these are toxic to microbes and not to the mammalian host. Resistance can be by decreased antibiotic influx, or there can be efflux by active transport pumping mechanism, or there can be reduced access of the drug to the ribosome. Ribosome protection proteins are formed, so ribosome's access of the drug is not there. And there can be inactivation of the drug by the enzymes, which will metabolize the drug, and by the cross resistance. This is the normal how this is the normal situation, how this from the porins the drug enters, and then it attaches to the 30S ribosome, and it inhibits the amino cell tRNA to attach to the 30S ribosome of the mRNA. And this is the resistance when there is active transport system removes the drug by efflux with energy dependent system, how this tetracyclines get efflux and there is no killing of the bacteria, so resistance develops. Now, antimicrobial spectrum is they are effective against gram-positive cocci, staphylococci, streptococci, gram-negative cocci, gonorrhea, and meningococci, Neisseria gonococci, and meningococci, best gram-positive Clostridia, Corynebacterium, Bacillus anthracis, and gram-negative Vibrio cholerae, Haemophilus ducreyi, H. pylori, Yersinia pestis, Yersinia enterocolitica. Antimicrobial spectrum is these are effective against Rickettsia, Chlamydia, Mycoplasma, Actinomyces, Spirochetes, Entamoeba, and Plasmodium. This is the how this is the spectrum of activity is the same thing. The toxicity of the tetracyclines. Use of medication for a prolonged or repeated periods may result in oral thrush, means it can lead to the oral and vaginal fungal infection, or there can be nausea, vomiting, diarrhea, loss of appetite, mouth sores, black hairy tongue, sore throat, dizziness, headache, rectal discomfort. Or there may be this antibiotic treats only bacterial infections. It does not work against the viral infections. And unnecessary use or overuse of this antibiotic can lead to its decreased effectiveness. And this gastrointestinal, I've already told you, it causes the abdominal discomfort, epigastric pain, nausea, vomiting, anorexia, and then food may decrease these symptoms, but also decrease the absorption of tetracycline by 50%. So food does not affect the absorption of doxycycline. Means tetracyclines, the food, it decreases the absorption of the tetracyclines, and they also decrease the symptoms of the diarrhea also, but they also decrease the absorption. So food is not affected, does not affect the absorption of doxycycline. Tetracyclines, they also alter the gut flora, and they cause large bulky stools and diarrhea. And diarrhea subsides once the agent is stopped. And if there is continued diarrhea, fever, rising blood, white blood count, should be evaluated for antibiotic associated diarrhea caused by Clostridium difficile. Means if there is diarrhea, fever, and there is a leukophilia, so there can be it should be evaluated for antibiotic associated diarrhea caused by Clostridium difficile, and there can be esophageal ulceration strictures by the tetracyclines, and these can be prevented by taking plenty of water, not before the bedtime. And we are not take the drug before the bedtime, and we have to take the drug with plenty of water to avoid esophageal ulcerations and strictures. Allergic reactions can develop various hypersensitivity reactions, and if a patient is allergic to tetracycline, they should be considered allergic to all. One tetracycline, there is cross reactivity, and there can be photosensitivity reactions, means when they are after taking tetracyclines, they may develop rash when they get exposed to the sun. And then there can be red rash to blistering on areas, and these reactions are most common with demiclocycline. And photosensitivity can be decreased by avoiding the direct sunlight and by wearing protective clothing with sunscreen. Teeth and bone, they can be brown to yellow discoloration of the teeth can occur under the age of 8, and this can be associated with hypoplasia of the enamel. Dark effect of the permanent teeth can occur. It is dose related and does not occur in adults. These agents generally should be avoided in children under the age of 8. However, if they must be used, doxycycline will be the preferred agent. Means doxycycline, it is safer in teeth and bone abnormalities. And they deposit in the brain or bone also. They can chelate the formation with calcium. So we are avoiding these drugs, tetracycline, in pregnancy as well as in the children below the 8 because of the bone damage as well as the teeth damage, yellowish and dark discoloration, and hypoplasia of the enamel can occur. Doxycycline is safe drug. Renal and liver, they can cause hepatotoxicity, but less with doxycycline. And this is more with tetracycline and minocycline. And they also cause the renal failure by increasing azotemia from amino acid metabolism. Demicocycline, it causes diabetes insipidus, nephrogenic, and so it leads to inhibit the release of ADH from the hypothalamus. So these can be used in the treatment of syndrome of inappropriate ADH secretion also. And when these are expiry tetracyclines are used, outdated tetracyclines are used, they can lead to Fanconi syndrome and renal tubular acidosis. However, current formulations which do not contain citric acid as an excipient have virtually eliminated this possibility. Superinfections are that tetracyclines are frequently responsible for superinfections because they cause more marked suppression of resident flora. And so these can cause the superinfection by Candida albicans. Mouth, skin, vagina may be involved. This is the summary. They can cause GI infection, disturbances, they affect the teeth, bones. Superinfection can be caused photosensitivity more by demiclocycline followed by doxycycline. Renal, doxycycline is safe. Minocycline moderately safer than other tetracyclines. Hepatotoxicity can be caused. Vestibular abnormality can be caused, which is basically more by the minocycline. They can cause increased intracranial tension, hypersensitivity reactions. Drug interactions are these can they can interact with other medicines, like they form the chelating agents, chelating complexes with other drugs like calcium supplements, minerals like aluminium, magnesium, iron, cholesterol lowering drugs, penicillin compounds. Storage is kept at room temperature 68 to 75 degrees Fahrenheit. Keep away from light and moisture. And patient counseling is we have to take the drug with full glass of water to prevent the erosions and strictures and ulcerations. And these are taken empty stomach 1 hour before or 2 hours after the meals. And avoid exposure to direct sunlight because they can cause the photosensitivity and phototoxicity. And do not take milk because chelating can occur and absorption can be reduced. The course of antibiotics should be completed even if you feel better after a few days. And do not forget to keep the medicine out of reach of children. Therapeutic uses, these can be the drug of choice of the rickettsial infections, chlamydia infections, mycoplasma infections, atypical pneumonia, cholera, plague, and relaxing fever. This is the drug of choice, and basically the drug of choice is doxycycline. Alternatives, this can be used in gonorrhea, syphilis, doxycycline, streptococcal infections, resistant to staphylococcal, meningococcal, salmonella, shigella, and UTI. Other uses, this can be used in the malaria. Doxycycline can be used in chloroquine-resistant Plasmodium falciparum. In amoebiasis, basically in the luminal amoebiasis, these are effective. This tetracyclines. Acne vulgaris and leprosy. Now, individual tetracyclines, this doxycycline is having the good oral absorption, longer duration of action, so OD dose can be given. These are not affected by food. These can be given IV, less alternation to breast flora, gut flora, so less diarrhea. So there is even renal failure because these are eliminated in fishes through bile. Dose is 100 milligram BD for day 1 and then 100 milligram OD. Adverse effect is more photosensitivity. Minocycline it is having the good oral absorption similar to doxycycline is that. Good absorption is there, least alteration of blood flora, so less diarrhea. Food does not affect the absorption. This is longer duration of action. OD dose can be given and can be given intravenously. Differ to doxycycline is that photosensitivity is less and it is having higher concentration in saliva, CSF, and tears, and it causes the marked vestibular side effect. And it cannot be used in renal dysfunction. Has additional activity against leprosy. Minocycline has additional activity against leprosy. Demiclocycline is similar to other tetracyclines, but it can be used in syndrome of inappropriate ADH secretion because it inhibits the release of the ADH from the hypothalamus. It is highly sensitive to photosensitivity also. It is having highest incidence. Oxytetracycline is commonly used earlier. Absorption is incomplete affected by food. And the duration is shorter. So 4 times or 3 times can be given. And this is unsafe in both renal and hepatic dysfunction. Precautions. All tetracyclines should be avoided below the age of 8 years, avoided in pregnancy. Phototoxicity is highest with demiclocycline followed by doxycycline. Vestibular toxicity is seen by minocycline, except doxycycline as all are unsafe for the kidney. That's kidney failure. We cannot give them. Chlorotetracycline and methacillin are no more used. Thank you. That's all for the tetracyclines. I hope you understood my lecture. And if you have understood my lecture, kindly subscribe to my YouTube channel. That is Dr. Nitika Hans Pharmacology Discussion. Thank you. Be safe, be happy, be healthy, be happy, happy learning, be blessed. Thank you.